What's the difference between cosmetic dentistry today and cosmetic dentistry of 15 or even 20 years ago?
Oh boy, world of difference, light years of difference. I guess 15 or 20 years ago, cosmetic dentistry might have consisted of maybe the rudimentary stages of bonding or porcelain to metal crowns that typically both of them would have a very opaque, almost chiclet-like look to them. And what we refer to around the old crowns, black line disease, a dark line up at the gum line. And typically, dentistry that you could pick out across the room is not being natural teeth.
Absolutely, yeah, that's not something that's attractive.
Correct. And as of, for today, it's just miraculous what we're able to do. That we can, whether it's with veneers or all ceramic restorations that have the translucency and depth and opalescence of real teeth, that literally for me, that the greatest compliment is that when people see our patients, they just say, wow, God blessed you with beautiful teeth. It's not like, oh wow, you had your teeth done kind of a thing.
And that's the ultimate goal. That's probably the best compliment you can get.
Oh, that they don't even know that they had dentistry done. It's just that they think that God blessed them with beautiful smile.
Now here's something that I recently learned, and I think a lot of our viewers will be shocked to learn this as well. It's that dentists don't have to have any special or additional training to call themselves a cosmetic dentist. Can you tell us a little bit more about that?
Absolutely, I'm glad you brought that up. In dentistry, there are recognized specialties like orthodontist or an oral surgeon where they have to complete a certified program. In cosmetic dentistry, there's no such regulation at all. As a matter of fact, if you look in the yellow pages or drive down the street, all the signs, everyone is a cosmetic dentist. And there's just a tremendous variation in the amount of training and expertise and experience that dentists have, and it's unfortunately it's up to the patient, to decide where they elect to have their work done.
So a patient really has to do their research and find out the information. And speaking of that, a lot of people watching at home probably want to know what kind of training that you've had in cosmetic dentistry.
I've been fortunate enough to have been exposed to really the giants of our profession. I've completed the most comprehensive and intensive training programs available in the world to the point where I've been an instructor at all these different institutes, which literally I like to refer to as sort of like the movie Top Gun. Literally where top dentists go for the most advanced training available. And again, that I was fortunate enough to be asked to be on the faculty and instructor at these different organizations.
That's definitely impressive.
Thank you.
Now, I want to find out, getting back to relaxation dentistry, how do you use relaxation dentistry and cosmetic dentistry together in your office? How do you use that to improve people's lives?
Well, it's one thing, to make someone smile beautiful, and that should be enough. However, if we can do that in an environment in a way that's a non-stress, totally painless, comfortable, practically enjoyable atmosphere, that's the best of all worlds. And there probably are a lot of people that would love to have a beautiful smile, but it's the fear in the back of their mind or the apprehension, whether about how the procedure is going to work or how they think it's going to come out that might be holding them back.
Now, can you give us an example of a smile makeover that you did using relaxation dentistry and how it impacted that particular patient's life?
Sure. Patient comes to mind. Harold came to us after one of my first television interviews over 15 years ago. His history is that he'd been the ideal dental patient. Went every 6 months, whatever the dentist told him to do, he did. Unfortunately, he was one of the baby boomers with a mouthful of silver fillings. He literally had over 100 fillings in his mouth.
Wow.
And every time something would break or decay or chip, they would just fill the tooth more to where his fillings had fillings, and his teeth were literally crumbling. And he was unfortunately losing teeth. And after a thorough examination and listening to what he would like to see happen, which one was have his teeth and then have them be attractive, we worked with him over a period of time and literally redid his mouth. And the neatest thing is now over 15 years ago, he has never had a filling, a cavity, a crown. He's had one dental procedure in 15 years. And he's retired, and I always joke that we'd like to hire him just to sit in the waiting room to talk to patients about our philosophy and how it's worked for him.
That's an amazing story. Now, I've been reading also more and more about bacteria and how the bacteria in people's mouth can actually lead to heart disease, Alzheimer's disease, diabetes, and even low birth weight. And also, medical research is linking that oral bacteria to chronic inflammation in the gums, which can set off medical problems elsewhere in the body. And I also hear that that bacteria can get into our bloodstream and cause heart disease, and these are really serious problems. Can you elaborate a little bit more on that for us?
Yes, I think it's great that research is finally bringing this to the forefold. In the past, to think that different body systems didn't interact or affect one another, just didn't make sense. Now we know, especially in people who have inflamed gums that might bleed on brushing and flossing and even eating, that is a direct, portal of entry, for bacteria, which the mouth is just full of bacteria, directly into the bloodstream. These bacteria can, one, seed infections in other different parts of the body, and for two, cause a generalized inflammatory response. And this is what a lot of attention is being devoted to now. We know that there is a rise of certain markers in the blood, C-reactive protein being the one that's most talked about today, and we know that this inflammatory process, it can aid along the process of atherosclerosis, the hardening of the arteries, the deposits in the bloodstream, also irritating the inside lining of vessels that can cause clots, which are all indicators for heart disease, links to, as you said, low birth weight babies, diabetes, Alzheimer's disease. Anyone who's into health and prevention is probably hearing about these things all the time, and it all comes back to the mouth.
So they're really all joined together. So taking care of your teeth and your mouth is really taking care of your overall health.
Absolutely. This C-reactive protein now is becoming known as a more reliable marker as a potential heart disease than even the cholesterol test that everybody knows about.
Well, that's definitely good information to have. Now, I want to get back to the bacteria. If that bacteria is now believed by researchers to be bad for our long-term health, as we discussed, does that mean that crooked teeth that are hard to clean and even those old fillings that we discussed and crowns that might have gaps in them are places where even more bacteria can grow and cause these problems?
Absolutely, absolutely. We already talked a little bit about the old fillings that literally, out of thousands of old mercury fillings that I have taken out, I can't think of one that didn't have leakage or recurrent decay underneath it. Also, anyone who's ever had an old crown removed will never forget the smell or the odor that comes out from underneath that, which is from bacteria. Lastly, not only for general health, but when you talk to a room of baby boomers, anybody over 40, raise your hand if you've had a root canal, raise your hand if you've had a crown. And practically every one of these teeth goes back to an old silver filling that was placed when they were a kid, that it's leaking underneath, re-decaying, and gives them a toothache or actually cracks and splits the tooth. So a lot of what we do is trying to get to these teeth a day before that happens than a day after.
Absolutely. And I've got to tell you that probably a lot of people sitting at home, just like me, underestimated the importance of good dentistry. So speaking of relaxation dentistry, now that it's available to your patients in particular, it sounds like everyone just needs to pick up the phone and come in and see you.
I hope so. We always like new patients. The neat thing, like I talked about with Harold, is that our practice is probably more dependent on new patients because rather than everybody continually breaking down, once we get somebody's mouth fixed, they need very little dentistry. So for us to keep going, we need to be able to help new people.